Hello, my name is Lauren Golson and my presentation will be on congestive heart failure. Some of the objectives we will be going over in this presentation include what is congestive heart failure, risk factors for congestive heart failure, clinical manifestations of the disease, left-sided versus right-sided heart failure, diagnostic studies, interprofessional care, and also nursing management. So we're going to begin with what is congestive heart failure. Congestive heart failure, or CHF, is a syndrome in which the heart is unable to pump blood effectively. So there is a defect in the way that the heart either empties or fills with blood. And because the blood supply is insufficient, there is also an insufficiency of oxygen that is going throughout the body. This is a major health issue in the United States. According to the American Heart Association, there are an estimated 650,000 new cases of heart failure diagnosed each year. So this is a very complex and chronic condition. Next, we're going to discuss risk factors for congestive heart failure. So some common risk factors include hypertension, coronary artery disease, rheumatic heart disease, congenital heart defects, which are defects that a patient has had since birth, and also valvular disorders. Hypertension and coronary artery disease are going to be two of the primary causes of heart failure. And when discussing heart failure, we also want to keep in mind that there are ethnic disparities that are associated with this disease. So African Americans have higher incidences of heart failure. They develop it at earlier ages in life, and they also have increased mortality rates in comparison to Caucasians. So we always want to keep these considerations in mind as we provide care to our patients. Next, we have a picture of the 4 stages of congestive heart failure. This is a really simple, easy to follow picture of a more generalized view of heart failure. As you can see, there's no differentiation between left or right-sided heart failure. And we can explain this to patients that if they see any of these symptoms, they can, of course, come into their healthcare provider and present them and let them know what's going on in their bodies. They don't have to specifically know if it's left or right-sided or all the details in between at that moment. They just want to go in and get themselves checked out. So for stage 1, they're going to present with breathlessness or tiredness, especially with brisk walk, a jog, or taking a flight of stairs. Next, at stage 2, they're going to be comfortable in resting, but their heart is going to begin to race, and they're going to feel breathlessness when walking a block or even taking the stairs. For stage 3, as it progresses, palpitations or tiredness with simple tasks, like getting up from the sofa and walking over to the kitchen, are going to occur. And with stage 4, the heart and breath go faster even at rest, tiredness even while sitting, and they're going to have anxiety and palpitations almost all the time. And these are obviously very uncommon, but somebody might not know, be a little confused, the patient, and misinterpret these signs for something else. So we really want to encourage our patients to come in and get themselves checked out. Next, we're going to discuss the clinical manifestations of heart failure. We're going to begin with left-sided heart failure. Some of the things that you might see presented in a patient with left-sided heart failure include dry hacking cough, weakness, fatigue, paroxysmal nocturnal dyspnea, which is a type of dyspnea where the patient wakes up at night with a severe attack of shortness of breath. You might also see in these patients left ventricular heaves, crackles in the lungs, behavioral changes, and also pleural effusion. And with left-sided, the patient is really going to feel like they're drowning because all of the fluid is building up in their pulmonary system, like their lungs. So for right-sided heart failure, we're going to see fatigue, anxiety and depression, right upper quadrant pain, nausea, right ventricular heaves, murmurs, weight gain, edema, and jugular vein distension. And we really want to pay attention to the weight gain, the edema, and the jugular vein distension because all of that fluid is building up in the patient's body. And we especially want to do daily weights on these patients to make sure that their weight isn't increasing too rapidly because that could be an indication that the fluid in their body is also increasing too rapidly. Now we're going to begin discussing left-sided heart failure. Left-sided heart failure is the most common form of heart failure. It can be further divided into 2 separate categories, which are systolic and diastolic, but we'll get to those on the next slide. And it also can result from either the inability of the left ventricle to empty adequately during systole, or the inability of the left ventricle to fill adequately during diastole. As stated previously, left-sided heart failure can be split into either systolic failure or diastolic failure. So with systolic failure, you're going to see that it results from the inability of the heart to pump blood effectively. And this is going to be diagnosed mainly from the ejection fraction of the heart. The normal ejection fraction is 55% to 65%, so anything that's less than that is really going to be indicative of systolic failure. And the result of systolic failure is going to be pulmonary congestion. With diastolic failure, this is going to result from the inability of the heart to relax and fill during diastole. Hypertension is the most important cause of diastolic failure, so we really want to help our patients who have hypertension maintain their hypertension and keep it at an optimal level of functioning, keep themselves at an optimal level of functioning rather, so that they don't progress further into heart failure. And the result for this is going to be the same as systolic failure, which, as I said, is going to be pulmonary congestion. On this slide, I wanted to add something that would help break down diastolic and systolic failure into simpler terms and make it more easy to understand. So with diastolic, you're going to see that the chambers of the heart have become stiff and thick, making it hard for the heart to fill the way that it should. And with systolic, you're going to see that the chambers of the heart are stretched and thin, which makes the heart unable to pump the way that it should normally. Next, we're going to discuss right-sided failure. Right-sided failure is usually going to result from left-sided heart failure. It's actually the most common cause of right-sided heart failure. So the right ventricle is going to fail to pump effectively because the left ventricle has failed to pump effectively and began to back up fluid into the pulmonary system. This is then going to force the right ventricle to work even harder than it had to before with all of this fluid overload that's happening. So the fluid from the right ventricle will eventually back up into the venous system, and this is going to create that edema and jugular vein distension we discussed earlier. And because all this fluid is backing up and it's overworking the right ventricle, eventually the right ventricle is going to fail to pump the way that it should. So next we're going to discuss some diagnostic studies that are used to diagnose heart failure. First, we're going to start with lab values. A lab value that is important for diagnosing heart failure is the BNP level of the patient. Next, we can do echocardiograms, and we can also do chest x-rays. Cardiac stress tests are also very common when trying to diagnose heart failure. We can do some nuclear imaging studies, and lastly, but definitely not least, we can do some cardiac catheterization. With heart failure, something that is very important is the interprofessional care associated with the disease. So we want to do some drug therapies, and we're going to try diuretics. A common one, of course, is Lasix. We're also going to use the renin-angiotensin-aldosterone system inhibitors, and one of those is an ACE inhibitor, such as captopril. And captopril, or ACE inhibitor of any choice, is mainly used to treat systolic failure. We can also use vasodilators such as nitroglycerin, and what this is going to do is just decrease the blood volume in that patient. Next, we can try some nutritional therapy. So it's really important for the patients to be on low sodium diets. We want to manage that weight because, as I said earlier, we really don't want them to gain too much weight too fast. It's really bad for their bodies. And in very severe cases, we can do fluid restrictions, but that's more so for, as I said, severe and chronic heart failure. And lastly, we can try some lifestyle modifications. We want to try to get the patients to have a lot of physical and emotional rest because this is a very taxing disease. It's lifelong, and there's a lot of things that go along with the disease to manage it. So we want to make sure that our patients are getting rest. We also want to have them in structured exercise programs as well as having them attend cardiac rehabilitation programs. So for the nursing management of a patient with heart failure, we want to make sure that we, of course, always start with our assessment. So we want to get an accurate, detailed, and thorough history and physical. We want to know what kind of medications they're on, and we also want to know what the dietary habits of our patients are. Next, we want to do the diagnosis. So some nursing diagnoses that can be used for a patient with heart failure include impaired gas exchange, excess fluid volume, and also activity intolerance. Next is the planning stage. So we want to see that there is a decrease in symptoms that the patient is having. We also want to see that there is a decrease in edema. So we want to see that fluid is going down, their weight is going down as well. And we also want to know that there is an adherence to the regimen because this is a lifelong condition as previously stated. So we must know that our patients are sticking to their goals in order to not make their disease exacerbate or get any worse. And lastly, implementation. We want to ensure that we do health promotion and we have acute care and ambulatory care available to our patients should they need it. So in conclusion, congestive heart failure is a very serious and complex disease. It is also a major cause of morbidity and mortality in the United States. We, as future nurses, and healthcare providers alike, must ensure that we educate not only our patients with CHF, but also our patients who have hypertension and coronary artery disease. We want to help them manage their diseases to ensure it doesn't further progress into heart failure. Lastly, we must work with our patients to improve their quality of life. Although heart failure is a chronic disease, it is possible to live with and manage the disease. We must help these patients to adhere to their regimens and especially encourage them to always be proactive about their own health. Lastly, here is the literature review I did for the article Heart Failure, Diagnosis, Management, and Utilization. It's a very thorough and detailed journal article that really breaks down and discusses a lot of important information that pertains to heart failure. It begins by defining what the topic is and then flows into more detail on the diagnostic studies performed to diagnose the syndrome. Following this, the authors discuss ways for healthcare providers and patients to properly manage the disease. And lastly, the article briefly gives information on how this syndrome is medically coded for the use of proper reimbursement. Here are my references, and that is all I have for you guys on congestive heart failure. I thank you for listening and following along with me as I went through all the information I could provide to you, and I really hope you got something out of it and learned something new. Thank you.